All right, we're going to get started. It's going to be a packed house today, so thank you for coming. My name is Josh Wynn. I'm the program coordinator for Buckeye Wellness through the Office of the Chief Wellness Officer. I want to thank you guys for everyone showing and tuning in on the webinar. Just a couple of quick updates from our office. Starting in January or this month, we have several new fitness classes. So if you want to register for those, you can visit yp4h.osu.edu. We also have a couple great programs coming up in the next several months. We have the ROTC Wellness Bootcamp, April 24th, and then the Amazing Race on May 15th. So look for those in the near future. All of the health and wellness events here at Ohio State are online, so you can look for those at yp4h.osu.edu/events. And lastly, with 2019 starting, biometric screenings are starting as well. So if you can visit linktohealth.osu.edu and also see Dixie outside to get scheduled. Today's Lunch and Learn is titled Tackling the Winter Blues. We have Dr. Ann McVey here. She is a clinical faculty member in the Department of Psychology and Behavioral Health here at Ohio State. She specializes in caring for patients who suffer with chronic health issues, many whom are dealing with life-threatening issues as well. We'll have about 10-15 minutes at the end for any questions. Those are tuning in from the webinar. You can shoot me an email, win.50@osu.edu, and then we'll get those questions answered. So without further ado, Dr. McVey.
Just one correction, it's the Department of Psychiatry and Behavioral Health. It's in the Med Center. The Department of Psychology is over on the campus, that other part of the university. Okay, is that better? Can people hear me? I do have a mic. I don't know if it works. I'm going to go ahead anyway. Seasonal affective disorder, or SAD, is something that I'm sure all of you are aware of living in Columbus, Ohio. I did a quick search on the web. We rank 7th in the nation for the most partial to heavy cloud-covered days per year. As of 2011, which was the newest, most recent information I could find, we, on average, experienced 296 cloudy days. That leaves us 69 days of sun. So when it comes, enjoy it. I do want to give a shout out to my daughter. I am an Apple user at home, so PowerPoint is not my forte. And at 8:30 last night, I was saying to her, I have no idea what I'm going to do. I've got these, these are not in PowerPoint. So she was kind enough to do them for me. I chose, let me say that the green is one of my favorite colors. And when she said, you have to pick something, I said, okay, I need something. I'm dealing with seasonal affective disorder. And one of the things that I'll talk about in a little while is you have to choose your environment and you have to adapt. So green is one of the things that I really focus on. If you come into my office, I have plants. I am fighting to keep my office that has a window, specifically because I need the sun when it's here. So let me see if I can do this. So what is SAD? Well, first of all, it is something that we categorize out of the Diagnostic and Statistical Manual for Mental Health or Mental Disorders. It is a type of depression or bipolar disorder that has a seasonal pattern. Okay, so it falls under depression or bipolar disorder. It is not completely separate. The onset and the remittance of it is tied to seasons. So for most people, it starts in the fall and runs through the winter. Come spring, Everything seems great again. Okay? So it goes away in spring and summer. And then here comes the fall again, and we're back to feeling down. In order to receive a diagnosis of SAD, okay, it has to have occurred for 2 successive years. Okay, you have to have had this pattern for 2 years. And there can't be an episode in between of depression. So in other words, you can't be depressed in the winter, things are pretty good in the summer, but then you get depressed in the spring, things are good, but then you get depressed in the summer. It doesn't work that way. And over a person's lifetime, these depressive episodes that occur kind of this winter, fall, winter, are more, they're what a person has more often than any kind of non-seasonal depression. So in other words, depression in other parts of the year. And this, I think, is what is interesting right here. It can occur in the summer, okay? Some people have a pattern where come the spring, they start getting depressed. They're depressed throughout the summer. The fall comes and it resolves. And that's their pattern. We'll get into symptomology in a minute. I'm not really going to talk about it. It's not that common, and there isn't that much in the literature on it. Okay, so the history, just briefly. Okay, 300 BC, we find mention of the changes that occur in a person's physical and mental health that are tied to the seasons, that are tied to the waning of light. Okay, so it goes back a long way. In 1806 or sometime like that, there's a French psychiatrist that made mention of the fact that he was noticing that his patients really, their mood tanked come winter. But for us in this country, in 1984 is when it was first described by Norman Rosenthal when he was working at NIH. Now, Rosenthal comes from South Africa. Okay, it's south. It's below the equator. Okay, but when he moved to DC, he noticed that his moods changed with the season. So there were other people, there were a couple other researchers at NIH who at that point in time were looking at the effects of sunlight on melatonin. And he kind of got together with them and said, hey, I think something's going on here. And so with that, in 1987, we have the first description of SAD, seasonal affective disorder. Depression with a seasonal pattern showed up in the DSM-3R. Okay, we're now on 5. So we've had many revisions since then. So that's just a brief history. So you want to guess what the symptoms are? Anybody? I'm sorry? Come on, you know them. Tired, sad, what else? Anybody? Lack of sleep, no interest in things. They're the same symptoms as for depression, okay? Sadness, irritability. You might find yourself crying a lot more. You kind of feel hopeless. When is this ever going to end? You have problems concentrating, solving problems. You really don't want to do anything. Social withdrawal. Gee, do you want to go out and get together with friends at 7 o'clock at night when it's dark already and cold as hell? No. You feel tired and lethargic, low energy, decreased motivation to do a lot of things. Why am I even trying? There can be thoughts of death. You want to, and this is a difference between depression, we'll get to this in a moment, depression, major depressive disorder, and usually seasonal patterns. Usually with people that have a seasonal pattern, they want to sleep more during the day. They find themselves, if they could just put their head down on the desk, they would be fine and take a little nap for a couple hours. They crave carbohydrates and sugar. Okay, look at what you're eating. It's good stuff. And they tend to gain weight from overeating. Okay. Now then, there are different levels of severity. Remember, this comes under depression, bipolar disorder, 1 and 2. So it can be as severe as somebody who has run-of-the-mill depression and they're hospitalized. It can put you out of commission. Or you might just have the winter blues. I feel a little down. Things aren't quite as much fun, but I can still do this, okay? But you notice that there's a seasonal pattern to it. So how do we tell the difference? When do we know to give a diagnosis of SAD? Big one. Seasonality of mood change. Remember, you got to show a pattern that this happens in the fall and winter. Doesn't happen in the spring and summer. I have one of my closest friends. Come October, I say to her, have you pulled the light box out yet? Because she'll be talking to me on the phone and I can hear it in her voice. And it took me 3 years to convince her that a light box would help. A lot of people are very resistant. No, it couldn't be me. It's not that big of a deal. You know, I'm not suicidal. I just don't feel like doing anything. So symptoms usually focus on a sad mood, hypersomnolence. In other words, you want to sleep during the day. It's not just that you're tired. It's not just that you're not motivated, but your sleep cycle's off somehow. And you crave those carbohydrates. The more, the better. I want to stress that it is very important if you think or you know of somebody to see a professional to get a diagnosis, because there can be other physical things going on. And that's partly what makes diagnosing seasonal affective disorder difficult. You can have chronic fatigue syndrome. Hypothyroidism has many of the same symptoms, okay? Drug and alcohol abuse. Oh, hypothyroidism showed up twice. Oh, well. And trying to think what I put in there that was different. Eating disorder. I tweaked these this morning. It's my fault. Eating disorders. So you've got somebody that's binging carbohydrates in the winter. Can't get enough of them. Eating all the time. Well, is that because they have an eating disorder, or is that because they really have depression with a seasonal pattern? Okay. And we have to rule out things that might be a seasonal stressor, like every fall you're laid off from your job because you're a farm worker. And what are you going to do for money? Okay. There are seasonal stressors that could be occurring. You need to rule those out. And the poor people that are working for the government right now, I don't know. Prevalence. I think it's important that as you look around in the audience, okay, more women than men. It occurs 4 times more often in women than in men. And for women, it usually occurs during childbearing years. Once you go through menopause, it tends to decrease. It makes me wonder what are the hormonal changes. Onset of age is between 16 and 30. You seldom see it under kids, young kids that are depressed. There usually isn't a seasonal pattern to their depression. Rates decline as you get older. For that, I'm grateful. And it equalizes between men and women. If you have a family member who has a mood disorder of some sort, has been diagnosed with SAD before, major depressive disorder, bipolar disorder, you're at a higher risk. And again, if you're living way north or way south, much higher, because what do we know? No sunlight. My aunt just came back. I can't believe it. My 86-year-old aunt went with her granddaughter to see the northern lights in Norway out in a dog sled. I said, how'd you do? And she said, it was great. I said, but it's dark. And she said, yeah, but they have lights. Okay. And you'll find out about what I mean by that. And again, it can co-occur. ADD, eating disorders, drug and alcohol. So if you have ADD, you're more prevalent, more likely. I think this is important. How many of you work night shifts? Not that many, good. But when you think about it, the nurses in our establishment who work at night, one, they're women, 4 times more likely to have it, and they don't get that much sun. They get even less sun than we do. Okay? And then if they've got a family history. In Nassau, I think it's interesting. I was going to talk about this in treatment, but I'm going to say it now. At Nassau, when you go into night shift, the lights are very low, and then they come up as if the sun is coming up, and you have daylight, and then they go down as you're about to leave. And they have found that that really helps their employees with mood disorders. Etiology. So why do we have this? So there's monoamine depletion hypothesis is one of the, all of these things I'm going to tell you kind of work together and no one really knows. The research out there, most of it comes from the Nordic countries, Finland, Sweden, Norway, and from our upper Vermont, Seattle, those kinds of places. Anyway, people with SAD have difficulty regulating serotonin, the feel-good neurotransmitter, one of the ones that we have to have in order to feel good. Excuse me if I want to do just a little. So SERT is a protein in the brain that transports serotonin, and I don't mean to talk down, but if we've got the synaptic cleft, the area between the 2 neurons, okay, you've got a signal coming down a neuron, communicating. Serotonin is released into this area in between the clefts, okay, looking for, floating around, where are the receptors on the other one so that we can continue. Excuse me for being, I don't know my audience, so. But SERT resides in the presynaptic neuron. And its job is to make sure that our body doesn't waste any of the serotonin that's produced. So what does it do? It looks for serotonin to bring it back to the other first neuron, the synaptic cleft neuron, okay, so that we don't waste it. Well, what does that mean? There isn't as much serotonin floating around, okay, and if you don't have it, so higher levels of SERT lead to lower serotonin activity, causing depression. So guess what? Individuals with SAD have found to have 5% more SERT in the winter months than they do during the summer. Okay? Then we have this hypothesis, which has to do with melatonin, the phase shift. We get out of rhythm. People with SAD overproduce melatonin. It's the hormone that causes sleepiness. That's normally depressed by bright light. What do we not have in Ohio? Bright light. As the days become shorter, melatonin production increases to say, hey, you know what? It's 6:30 and it's dark outside and it's time for bed. Okay, and in the morning, it's not 6:30 and it's light. It's what, 7:30? 8 o'clock, 7? I don't even know. Okay. But there isn't that much light, which means melatonin production is not inhibited, which means that the circadian rhythm gets out of whack. People begin to feel sleepy and sluggish and lethargic. And when you disrupt a sleep pattern, it contributes to depression. Now, we operate our circadian rhythm, although they say a 24-hour clock, is really a 25-hour clock. So if you let yourself go, normally, your sleep is going to advance, and you're going to be sleeping during the day. Think about the poor teens that have to get up and be at school by 7. There's somebody that stands at a bus stop at 6:15 in the morning with their child to get on the bus. I cannot believe it. Anyway, our circadian rhythm is affected by the environment. What is the temperature? When you're sleeping, do you keep your room hot or cold? Because it makes a difference in what your body does and how well you sleep, as an example. But it's most affected by daylight. And it is also affected by serotonin and melatonin and serotonin production. For those of us that are up north and don't have enough sunlight, our production of vitamin D goes down big time, which helps with serotonin. Again, there's all these feedback loops. We are a wonderful, complicated being. The less outdoor sunlight you get, the lower your vitamin D. And vitamin D, we already know, is linked to depression. So what are we going to do for treatment? This is the fun part. What's the most important thing, do you think? What does research point to all the time? What do you hear about? Light boxes. They are the most studied treatment. The treatment, and it is shown to be effective. It replaces sunlight, but here's the kicker. It has to emit a full spectrum white light. There is some research looking at blue light, but it hasn't found that blue light is any more effective than white. You need to make sure that you get a box that filters out the ultraviolet wavelengths, and it has to be at least 10,000 lux. Now, I don't care what kind you get. You can get the kind that stand up and you stand in front of them. And as you're standing in front of them, I have one of my patients that got one of those because she puts it on in the early morning. When she gets up, she goes to her treadmill. And she's walking her treadmill with her light, reading her book. I don't know how she does it. Anyway, you have to be positioned 12 to 18 inches. from the light in order for it to be effective. And you need to start with 30 to 45 minutes a day. Eyes need to be open. You can't do this sleeping. I had a patient that asked me, can I just sleep? My husband will turn it on. He gets up before I do. He can just turn it on while I'm in bed. I'm like, no, I'm sorry. You got to be awake. Okay, but you don't have to stare at the light. That's not necessary. So you can be reading, you can eat breakfast. I know some people that actually put it on at work. They have it at their desk. Now, the kicker with that one is you can't get up and go to the bathroom, or you can't go see a coworker. You have to sit in front of it for 30 to 45 minutes the whole time. And then you can get up and go. But you got to give yourself that period of time. So after your symptoms have remitted, which usually can be as early as a week, maybe 2, then you can figure out how much time you really need to sit in front of it. Maybe you only need 20 minutes 5 days a week. Adverse effects: eye strain, headaches, difficulty sleeping, irritability. These usually go away pretty quickly. The difficulty sleeping is when somebody doesn't do this within getting up, and they wait until the afternoon and sit in front of the light box. And it's like, it doesn't work that way. Then you're really messing with your circadian rhythm, because it thinks that the light has just come on, and your body doesn't really know what to do. Light therapy is very effective. Now, for a lot of people, what they don't like is taking the half hour to do it. They don't want to sit still that long, okay? If you do an open eye meditation, you can meditate while you're doing it. Antidepressants: the SSRIs have been most studied, Prozac in particular. Think about what I said. People with SAD have difficulty regulating serotonin. So if you inhibit that reuptake, you're going to have more serotonin floating around. Wellbutrin, bupropion, is the only drug approved by the FDA for preventative measures. I have another patient, come Labor Day, he goes on Wellbutrin. Middle of March, he goes off. Makes a big deal of difference for him. He can't sit still. Of course, we have adverse effects of the medication, and it also takes longer for medications to kick in. I mean, light box, you're looking at a week, maybe 2. Medication, you're looking at a month to 6 weeks for it begin to feel the effects. Vitamin D, there's some researchers that are suggesting that for people that have low levels of vitamin D, and I would highly suggest, don't just start taking this large amount of vitamin D. Go to your doc. Okay, make sure that you talk to your doctor about whether you have low levels to begin with, because there can be adverse effects. What about therapy? You can come see me. Cognitive behavioral therapy is what's really been studied. Why? Well, there's behavioral activations. Anybody, in other words, CBT, cognitive behavioral. First, we deal usually a lot of times with behavior. So you don't feel like going out. You don't want to do anything. Nothing's fun anymore. So what I do is I get my patients to list what they like doing in the summertime. You know? Tell me what you like to do. What is fun? Once they give me that list, then we work on how are you going to schedule it, when, where, and I hold them accountable, because that a lot of time helps them do it, okay? I also work on helping them avoid behavior that really is not good for them. In other words, I am feeling so overwhelmed, even getting out of bed is hard. Okay, I get it. Do me a favor. In the morning, when the alarm goes off, I want you to think about the coffee that's waiting for you. And all I want you to do is sit up in bed and put your feet in your shoes, because that's all you have to do. And once they've done that, they're usually able then to move forward. It's like, oh yeah, I can smell that coffee. And okay, maybe I don't want to go to work today, but I'll work on it. I'll get out. I'll get going. And we develop a plan. Cognitive skills, let's think about this differently. Okay, you can say to yourself, so you're really tired, and then you can start beating up on yourself with all kinds of negative statements. Well, I must just be lazy. No one else has this going on. What's wrong with me? I can't get anything done. Okay, so let's stop that. Or they're saying, I hate winter. That's my friend. God, it's November. How am I going to get through this? Well, there's Thanksgiving coming up, and I'm going to come see you. Think about it differently. Not I hate winter, but I can get through this. I'm going to find things to put in my schedule for me to do. Okay, for me, I'm thinking, I gotta light candles. I don't do that in the summer. Okay, I think, ooh, soup time. I don't eat hot soups in the summer. So I find things that I enjoy and tell myself, this is a special time because this is the only time that I really get to do this. So I think about it differently. I look for things in particular to be grateful for. There's a lot of buzz nowadays about acknowledging what you're grateful for. That does help. That's part of cognitive restructuring and reframing. How do you think about it? What are you saying to yourself? Pay attention, because it makes all the difference in the world. Oh, and just going back, the cognitive therapy and light therapy have been shown to be equally effective. The deal is it takes longer, again, with therapy, cognitive behavioral therapy, than using a light box. But cognitive behavioral therapy does have a longer remission, if you want to call it that, because you're learning skills. Every year you got to pull that light box out. With cognitive behavioral therapy, you're learning skills that you can employ and use when the next fall comes around. Okay, lifestyle strategies. Get as much morning light as possible by opening your curtains. That's the first thing I do when I get up. Open my curtains. Sit by a window. Right now, I'm in this discussion about moving my office. And I'm saying, I don't want to move. The main reason, I have a window. Okay? The poor folks in the Department of Psychiatry that are over, sorry if anybody's listening, the poor folks that are over, some of them that are over in Upper Arlington, have no window. It's like an exam room. I couldn't do that. I literally could not do that all day. When I say adjust your environment, I change out for winter. Okay? I put up my twinkle Christmas lights around my windows, around my mirror. I put my candles out. The colors in my house, although I can't change my rug, okay, I throw different colored throw pillows that are softer. I use those. I make it soft because that's what I need in the winter. Other people may need other things, okay? But jarring and things that do this to me, I can't do in the winter. I have to breathe and go forward. It's a time for me to do internal reflection. I don't want this. Maintain your normal routine. If you normally go to book club once a month on Tuesday, go to book club. If you normally get together with friends on Wednesday, get together with friends. Don't change. Big one, exercise. Exercise is the main thing that we know treats depression. Remember, seasonal affective disorder is a form of depression. Exercise, and I'm not talking about, and they say it helps for your health and everything, I'm talking about 35 to 45 minutes, just like the light box, consistently 5 times a week. Move. Get those large muscles moving. We know that that helps with the, and I just blanked, the what production? The feel-good stuff. Well, yeah. Decrease your sugar and simple carbohydrate. Change your diet. Work on changing your diet. I did this by treating myself, okay? It's like, I really want those peanut M&Ms. Okay, so I'm not going to do peanut M&Ms, but what I will do is I have chocolate that's 75% dark chocolate, truly 75% dark chocolate, and I allow myself a little bit of that. Now, what I learned was Dove chocolates, even though they say dark chocolate, are not dark. So they don't count. Get outside into the fresh air. Take a walk. I don't care what the temperature is. Take a walk. Get outside, at least 15 minutes. You can do that. Okay? For Christmas, I got these wonderful gloves. They're like, they come to here. They're mittens. My hands sweat in them if it's not below like 20 degrees. On purpose, so that I can get outside every day. I have to walk a dog. I hate it, but I am grateful. Because if I didn't have to walk her, I mean, she won't let me not. Find new activities you can do in the winter. Practice relaxation. Okay? Under the next slide is meditation, but I'm going to say this here. Our EAP is a wonderful website, and they have relaxation that you can download. Relaxation thingies. They're wonderful. I give them to I cheat because not all my patients are OSU employees, but I give them to my patients because they're great. They've done a great job. Because managing stress is very important. I didn't talk about it. That's a whole nother lecture. Okay. Spend time with friends. Don't cut people out. Just because you don't feel social, don't cut people out. Because when you get there, you're going to feel better. You'll feel a lot better once you get there. It's getting there that might be difficult, and that's where you chunk it down. Okay, I just put my feet in the shoes. I just put my coat on. I only have to walk to the door. I don't have to do anything else. Just walk to the door. Okay, maybe I'll turn the car on then. Okay. This one, schedule a vacation to a sunny location. I do that. Okay. Over winter break, January, whatever. All of us need a break. But if you're going to take a break, go someplace sunny where there's light. Okay. Meditation, de-stress. I don't care how you do it. Deep breathing. Listening to guided relaxation, that's the EAP. There's been a lot of research on transcendental meditation and an effect on SAD, and they have found that it's effective. In today's world, there's a lot of buzz about mindfulness-based stress reduction. Okay. It basically is focused attention. With my patients, we do this in session. Yoga is a form of meditation. If you have a religious affiliation, many times there will be meditation through the organization. I have to tell a story on my brother. My brother, who is a staunch hard scientist, okay, PhD in molecular genetics, and works for a drug company developing cancer drugs. Anyway, nope, all there is physical reality. You can't touch it, see it, smell it, whatever. It doesn't exist. Was going through a hard time, and I said to him, well, why don't you just look into meditation? Help you relax, help you do something. So he lives in Maryland, and up the road is a Wan Buddhist church, temple. Wan Buddhist it comes out of Korea. Okay. So my hard scientist, who still is a hard scientist, has been doing meditation with the Buddhists, and he calls them his Buddha buddies, for the last 3 years. Complete turnaround. Not that he has necessarily changed his religious beliefs, but having a community where you go and sit in meditation, where you consider what you're thinking. He does some teaching now at one of the retreats because he's able to explain something that sounds just like cognitive behavioral therapy, but how thoughts affect your feelings and how you change them and what you do, okay? So just because it's a religious affiliation, don't assume that you have to change your belief about your spirituality. But they do offer many times things that are very helpful, and it is a community, which is very important. I put in a plug for the EAP. Go to their website. And then there's integrative medicine. How many of you know about our integrative medicine? Good. Massage. I'm not sure if they're doing acupuncture at this point in time, but they are a great resource as well to help. Okay, so in summary, just really quickly, seasonal affective disorder is on a continuum. From really mild, oh, I just feel really kind of blue in the winter, to really severe depression. The kicker is that there's a seasonal pattern to it. That's what you have to be aware of. And so then how do you prevent it? You need to think about how do you prevent it. If you know it's coming, prepare. Okay? You know the winter's coming, you prepare your yard, your garden. Why wouldn't you prepare your body? Okay, questions? Research on melatonin has been back and forth. Right. But what I would suggest is that you look at, the website. There's a website that tests the different supplements because not all supplements are equal. And if you're going to be taking, I recommend melatonin to my patients. It's like, try it, you know. If it doesn't work, it doesn't work. You're only out a few bucks. and I'm trying to think of the website, and I can pass it on to you. But getting a good supplement is very important. And the thing about supplements, you want to stay away from pills if you can. If you can get it in capsule, liquid form, better, it's more bioavailable.
Going once. Going.
I'm sorry? Yes. Yeah, gummies aren't as, you don't get as much when you do a gummy. But if you'll do it with a gummy, then that's better than not doing it.
Anybody else? Going once? Going twice? All right. Well, thank you.
Thank
Thank
you.
you.